Welcome to the Fac Dev Lounge podcast, your DMNB podcast for faculty development. I'm Dr. Sarah Gander, and I'm here today talking with Dr. Hepzibah Muñoz Martínez. She's an associate professor at UMB in the Department of History and Politics, coming to us from Mexico, where she's spent most of her time during COVID, and a lot of her publications and book has been published. We're recording this podcast a week before the municipal election in St. John and surrounding municipalities, but I think the concepts she brings to us today will last and stand the test of time, as they certainly link health and the importance of healthy cities for us here in New Brunswick. So welcome to the Fac Dev Lounge podcast. Thank you for joining us. This is your faculty development podcast for Dalhousie Medicine New Brunswick. And I'm Dr. Sarah Gander, a general pediatrician and social change activist here in St. John. And so I'm very excited to welcome someone who people keep saying to me, have you met Hepzibah yet? So this is Dr. Hepzibah Muñoz Martínez, who's coming to us from Mexico, actually, even though we're recording this during COVID times. So she's there and has been for quite some time, but is an associate professor at UMB in comparative politics and political economy with the Department of History and Politics, and has actually been here in St. John since 2010. And so there you go. It's taken us 11 years to cross paths, Hepzibah, so I'm so glad to meet you. And we are on the cusp of a municipal election in St. John, and so I was just very excited to have you get on the podcast and talk about health and healthcare delivery and how that is super important coming up as people head to the election booth on Monday, or today, actually. But by the time they hear this, it won't be today anymore. So May 10th is their last chance to vote. So welcome.
Thank you, Sarah. Thank you for the invitation. I'm really looking forward to our conversation.
I'm so shocked at actually a lot of people that I work with and some of the students that I teach, just sort of the disconnect between health and municipal politics, because I think we all think that health is under the provincial government, but you and I, who have a special interest in the social determinants of health and see it differently, I thought it was really important to talk about some of those things today. So what do you think is kind of some of the important things that we should think about in deciding who we're going to vote for next week?
Well, one of the issues have to do with this story that I was just telling you about a student who has been taking my global health class. Also, she's been taking my urban politics classes, and she was telling me about this new show on Netflix called Amsterdam Hospital or something like that. And in one of the episodes, the prescription that was given to one of the patients in this show about hospitals and doctors was a house. So that was interesting. That kind of commentary makes a connection between housing and health. And municipal politics is crucial for this, especially in relation to zoning and urban planning. So for instance, let me just mention two things about zoning and urban planning. One is urban planning and housing. The relationship between the two of them involves real estate developers asking for permits to the city, right? So in this process, the city can actually promote gentrification, the increase in real estate prices, the loss of tenancy rights, or the decrease or implicit or informal tenant rights, or it can actually help to alleviate the housing problems. So how can it do that? Well, it can do that. So in other places in the world, for instance, the municipal government requests real estate developers to have a percentage of units available for subsidized housing. So that allows people that do not have, their income is not that high, to be able to be in a mixed income complex, right? And be treated the same way as the person that can pay rental market fees or rent. So, and I mean, for instance, I live in the Abbey St. Andrew, and a person with subsidized housing has the same attention in terms of maintenance as mine that pays market rental fees.
Yeah, I think that's a huge problem in St. John, just even with the vacancy rates for some of our patients who might be involved with housing or, be moved around because of certain levels of displacement. I mean, we've seen that in COVID with rents increasing and things, which is a complex problem as well. But I think most people think of housing as almost a federal problem, but what I'm hearing you saying is that there's a lot of municipal influence on what we can have as available for people to, rest their head at night, to put their medications in refrigerators, to have the structure and routine needed to be well.
Yeah, exactly. And that happens in the process of granting permits for real estate development. And the way in which the city can actually contribute to the housing crisis is by asking real estate developers, or just letting real estate developers to do whatever they want, especially catered to people with higher incomes that then drive the prices of real estate in places where usually people with low incomes live up, and that they cannot anymore afford anymore. So one of the things that, for instance, in my urban politics class, when students did ethnographic work in the city, they were coming across cases where, because now there's been a takeover of one very important real estate developer of another company that used to rent a lot of buildings in Uptown. They said that one of the things that happened was that tenants that work with at minimum wages and in precarious conditions, they saw their rent increase $300 overnight. So, and then they were like, no, I have to move out because I can't afford those $300. Maybe for you and I, $300 is not a big deal, but for people with minimum wages, it's a big deal. The consequence here in terms of health is you have people that are kind of informally displaced. They're further away from their community, so you have mental health issues there. Not that the existing social networks that keeps mental health in a person, that helps a person with mental health, but also that means that the issues like or facilities that were also favorable for people's health are further away, right? So if you have a park nearby, for instance, this is what's happening in the lower South End, where you have people that would rely on the Rainbow Park for their children. And as a pediatrician, you'd see how important it is, activity, being outdoors for children, especially for their health. And now, because of this process that is happening in the lower South End of gentrification, now some of these families have to move away where they might not have a playground for the children right across the street. So that's kind of one of the issues here. And we have to consider that also recreations and community parks are part of some of the responsibilities of municipal governments as well. And we already know what parks and community centers do to our mental health and our physical health as well.
Yeah, I mean, I think it's interesting. The audience of this podcast would be, St. John, but also surrounding municipalities as well, which are also going through an election. So it's interesting to think about, you said the word gentrification and then, talking about the displacement of folks, maybe even outside the urban areas into more rural areas, which is, creates a whole other problem around access to services and healthcare that you mentioned. But also, if people are leaving the city, I think one message we've heard with this election is how important population growth is in St. John. And so we want to keep our people in St. John, not to make it St. John centric, but that's where I live. So, we want to keep people in St. John because we're looking for sustainability.
Yeah, exactly. We want people to have access to services. The thing here, as I was telling you before in our previous interview, is that another thing to keep in mind is the fact that even if you have representatives at the municipal level that truly care about the citizens, that want to follow the right policies, there is a dilemma that St. John faces. St. John is one of the main engines of economic growth in the province. And what happens is, you have the city and the taxpayers that live in the city provide all these community centers, all these services, builds roads and maintains them, etc., for people that also come from outside the city, right? But they don't pay those taxes. So, and we were just talking about how, for instance, if someone that lives in Rothsay wants to use a community service in St. John, they can do that. But if someone that lives in St. John wants to use a community service in Rothsay, they cannot do that until they prove that they live there, right? So it's a challenging situation because you have a catch-22 where, you have the city or the province and other stakeholders might tell the city, oh, you need to promote job creation in the city, etc. But what if the people that occupy those jobs live outside the city right? So it's like the city might be better off not creating those jobs for people that live outside the city, because yeah, so it's a lot of expense for very little income that comes from that. Especially if you think about most of the commercial property, or at least around half of the commercial property tax that St. John has goes to the province. So I have, for instance, some numbers from the city of St. John 10-year financial plan. And in 2021, or the number they give in this report of 2021, it says that, for 46 million that of commercial property St. John sent to the province, only 16 million came back to St. John. So you have a lot of challenges, because also St. John, as the engine of economic growth, when you have industry, you require, for instance, fire
like
department
services and
sorry.
food services. Yeah.
Yeah. I was going to say in Spanish, bomberos.
It's okay.
But,
you can.
I was like, and so you have a situation where your budget for fire stations are cut, but you have industries that at some point, because of the kind of industry that they are, might require a lot of resources from the fire department. You also have, issues of policing that need to be addressed at the municipal level. One of the things that working in priority neighborhoods that has been really relevant for the people that live there is community policing. And that, again, falls under municipal government jurisdiction. And there are two things around this issue. One is that communities really appreciate the presence of community policing in terms of prevention, in terms of, having police engage with, youth that might, try to, or have the intention to transgress the law. So it really has a role in prevention of crime. And, when you have crime, you also have, people going to the emergency room, murders, injuries by guns, etc. So that's another reason why we should care about prevention more than response. And the other thing that a lot of people in the police department have told me is that there's a lot of things that have been downloaded onto them. And especially, they say, well, sometimes we take calls that actually should be answered by a social worker or a counselor or
like
a psychiatrist.
A
mental health. Yeah, a mental health practitioner. So that's something that we really need to keep in mind when we're talking about police. It's not just crime prevention or combating crime, but it also has a very important health component, especially in relation to mental health as well.
Yeah, mental health and social development. I think we see that in pediatrics, at least with some of our youth mental health crisis that we're going through, which is more, in my wheelhouse as opposed to some of the adult stuff, which, I wouldn't speak to, but certainly have observed as a serious issue.
And the nice thing about community policing, for instance, is that it avoids stigmatizing youth. It's more about a dialogue than saying you are bad and we're going to punish you. It's more about, let's talk about it. What's going on in your life that, that is making you behave this way.
Right. Well, I think we've seen that with a commitment to harm reduction with at least some of the current council folks and our current mayor, who started a task force on harm reduction, really, taking that approach of trying to support and not punish. But, so many challenges along the way, because these are some complex problems. I think we also talked about some really interesting things around infrastructure, Hepzibah,
yes,
how that directly affects health. And by that, I mean, we talked about water and sewage and this sort of thing. And I think that's, people forget the direct connection with health.
Yeah. No, yeah. So another responsibilities of the municipal government is water supply, distribution, sewage, and solid waste management. And this, as water is important for our health. At some point, there was talk about the public-private partnership to deal with, I don't remember if it was just water treatment. A lot of people say, this has already been tried before in other parts of Canada in relation to water, and the result has not been great in terms of, actually, when you have the private sector involved in water supply, it might end up, there might be contamination in water. That's one of the arguments. And then you have health issues, E. coli, etc., in the water. So, and also solid waste management, that's something that also falls under municipal responsibility. And that's so important. And that's something that we don't see, because we just throw the garbage out and then we just forget about it. But where does the garbage go? What kind of garbage is put in the landfill. Like a fluorescent light bulb can actually pollute liters and liters, that is broken and it's put in the garbage, can pollute liters and liters and liters of subsoil, of underground water. And that has repercussions in the long term on the environment.
Right. So there's these different levels of responsibility when you think about even just our contribution to climate change and emissions and handling waste. And, one of my students has this beef about, the students who come and stay with us, they stay down on University Avenue. And because they're living in apartment complexes, there's no recycling pickup. There's no ability to, there's no the compost and things. And, being a generation that's very in tune to that, it seems such a simple answer to our efforts, at least in climate change,
Yeah. And it's frustrating not to have those services available. And I think, again, going back to the budgetary challenges that the city faces, this investment in more sustainable, more health and environmentally friendly solid waste management involves a lot of spending initially, but then in the long term actually becomes cheaper. When you have those systems in place, when you have place for compost, when you can actually have processes for composting from tea bags to paper to also, the usual food waste, right? It actually in the long terms become cheaper. And that has been proven in Toronto, where they found it so expensive to ship the garbage to Michigan or at some place in the States. And then they say, okay, it's going to take a huge investment to do a more sustainable and environmentally friendly solid waste management. But once that took place, it became actually cheaper than exporting the garbage or the solid waste.
And really means that we're playing our part in trying to get to a more sustainable place.
And I think solid waste management should be an important part of the municipal agenda, that I don't think it has the proper attention that it should have for long-term issues, because everything is focused on the short term.
Well, we had a really exciting announcement here in St. John this week that was around active transportation. I'm old enough to remember when we did have bike lanes that took us from the north end to uptown that was sort of brief and, I don't know, dare I say a pilot? I don't remember the details of it. But there was at least an announcement today that those bike lanes are going to come back, and people are using the word permanently come back. But, there's been a lot of active transportation initiatives in this city, and that's something that I really pay attention to.
I think that's another aspect that we need to pay attention in municipal politics, especially in relation to health. With my students, we released a report. It's available in globalhealthnb.org, and it's called Moving Through the City. And we looked at active transportation and public transit during the COVID era. And there are two things. We found that a lot of vulnerable populations use the sidewalks, but there is no proper snow plowing. There's no safety conditions, especially in the winter that lasts a long time in St. John, for people to use sidewalks. We also have that for essential workers, people working at grocery stores in precarious conditions, people working in pharmacies, people working in long-term care homes. They use the sidewalks a lot. And at some point, one of the long-term retirement workers said, I had to jump over a bank of snow in order to be able to access the bus stop. So, and then you add another aspect to it, the lack of public transit. I don't know if you know this, but I think St. John has one of the highest surfaces of roads per capita.
It's something like 600 kilometers of roads or something.
It's something crazy. It's something crazy. So you have a car-centric society and city that gives very little space for concerns over active transportation, the use of a bike, the use of sidewalks, the connections between, because you can have, a sidewalk, but if it's doesn't connect to anything, what's the point? You can have a bike lane, but it doesn't connect people to recreation centers, to workplaces, to places where they get their services. What's the point? It's just to do
places
exercise.
Where you could even put your bike and lock them up so they don't get stolen. We found that at the hospital. We found that, when I remember the day that it was just the straw that broke the camel's back. It was a new mom pushing a stroller with twins, having her toddler with her. And of course they had taken 2 buses to get there in the middle of winter. It was February. And I remember a couple of the pediatricians and I, who had an office in the hospital at that time, just saying, for a large chunk of our patients, this just isn't going to work. It's just not. It's creating a barrier in a place where there are enough barriers. And so, moving out into the community, which is part of, like Horizon's philosophy around trying to deliver care, is something that I think is really important for our city, and making room for that and figuring it out for people.
Yeah, no, definitely. And active transportation, according to the WHO, is going to become the main form of transportation in times of pandemic, because it's safer, it allows for social distancing, etc. I think people still rely on public transit. And one of the things that came out in the study, and also in my experience taking the bus, is, like sometimes the drivers do act like social workers, right? Like they help people with disabilities. They talk to people that, that live alone, that are elderly. So it's almost like therapeutic, a therapeutic role that they have
Part
in
of
the
your
process.
Community.
Yeah, that and also they take people to places because they cannot afford driving a car. And that's another thing that came out in the study, that, when you have issues of climate change, when you have a car-centric city, shouldn't have a place in this context, right? And because it does have immediate consequences on the air, or the quality of air we breathe. And then you add the issue of, the kind of industry that exists in St. John. So the quality of air in the city might not be the best of all, right? So I think that's another thing to think about public transit. Not only, it deals with issues of isolation, it also helps people to move around the city when they cannot afford a car. And on top of that, it helps people save money, because if they have an efficient public transit system that is affordable to, they don't have to buy a car. And that allows them to have more income for things like nutritious food, for things like maybe rent, for things like medicine. So you have a combination of issues within public and active transportation that are closely linked to health, to physical activity, to mental health, to access to services, to saving money, to access things that you need, to afford things that you need for your health, that need to be put in the agenda. And I think one of the challenges is that, first of all, the city doesn't have enough money to sustain an affordable and efficient active and public transportation system, but also the province needs to step in and help with that. And I think one way to do it is by looking at active and public transportation as a public health issue that, as falls under the provincial level category. But we need representatives and the municipal government to advocate for that.
Yeah, but the intersection between provincial and municipal politics gets so interwoven, and the line between becomes so gray. Because even when we were talking about zoning before, I think you made the point when we were talking earlier about, who decides who has to stay home and whatnot. Easy for us to decide if we have, beautiful big homes that we're able to, quarantine in or what have you. But I think we've just seen in the past couple of weeks how difficult it was to make recommendations around quarantining when, like, say, you don't have a home, or your home is not livable all the time, or whatever.
Yeah, and that goes back to kind of the zoning issues and safety issues that the city has a role to play in terms of housing, right? In the ethnographic work that my students did in the city during COVID, or the earliest stages of COVID, was, a lot of people were saying, if you ask me to stay at home to contain the disease, but the reality is I can actually become more sick at home because there's so much mold, and I don't have any rights in terms of forcing the landlord to fix this. And then you also have landlords that's the only asset they have, and then they barely make it. So they don't have any incentives, they don't have any assistance in terms of helping these kind of things that affect health directly. Another thing that a lot of students were telling me, even in their own personal experience, was like, well, the people are making the decisions during lockdown are totally forgetting that a lot of people also live under conditions of violence. So if they don't end up having COVID, they end up being beaten up or to death, right? So one of the things that they said was, like, if COVID had happened while I was in this or that relationship 2 years ago, I would have been dead by now because I was in an abusive relationship. So going back to the municipal government level, what kind of community centers are in place to also allow people to be able to escape these violent conditions. Is what kind of supports are there for nonprofits that deal with vulnerable populations that have to escape violent situations at home, right? So it's so complicated.
The mental health, or the
mental
addictions,
health, yes,
or the
exactly.
The stuff that we've really clearly seen become more of a problem during COVID. So,
and that has to do with zoning as well, right?
Yes.
Are these facilities accessible to people near where they live? Do we have one big center where people from all over the place has to come, or do we have small centers here and there where people need it and can go without the need of a car, without the need of a taxi, etc.? That's another thing, and that's one of the things that I think should be put in the agenda as well. And that has happened in a lot of European cities, where they said, let's try to plan the city around a 15-minute city. Like everything that you need, your work, your groceries, your leisure, is within a 15-minute walk.
Oh, we didn't even talk about food deserts, but that's a good point.
And that's part of it, yeah. And that has to do with zoning as well. Is the city promoting big box stores that are far away from people that do not have a car? Or are they promoting small vendor places, actually providing incentives for them to, have sites, etc., closer to neighborhoods, right? For instance, one of the things that has happened in other cities in Canada, in larger cities, is that the municipal government has forced big box stores to have smaller versions of those stores within the city core.
In different parts of the city core. Satellite store. Your satellite Costco down in the South Central Peninsula.
Exactly. Or you have your satellite superstore in the Lower South End. Or you have a mini Home Depot where the bargain shop used to be on King Street, right? Like, so, I mean, the fact that there's no bargain shop there, it's like, it was terrible for me. It was a tragedy for me.
Because that's where you like to go?
Yeah.
So Hepzibah, you wrote a book, Uneven Landscapes of Violence, Law and Accumulation in Mexico. And you mentioned that there was a whole chapter on healthcare workers and violence.
Yeah.
We should make a tie between that and what's happening now, because I think, albeit definitely not the same, but some parallels, no, with what we're experiencing now with COVID.
Yeah, it is interesting that you asked me that, because there are actually a lot of connections. One of them, I think, is the fact that, and I talk a little bit about this in my book presentation at UNB, the fact that sometimes we take for granted, especially upper classes and middle income groups, take for granted the kind of accessibility we have to municipal governments in St. John. And one of the things that I talked about and inspired the cover of the book was the fact that when I came to St. John, I was just living in one of the most dangerous states in Mexico. And one of the things that you would know shootings would start and you have to find cover wherever you were was when you would hear helicopters. And at that point in Mexico, especially in the 2010, you have a lot of violence. People that were disappeared, could be anyone. It didn't have to be from a particular income group or a particular political position. And you also have that a lot of health workers were targeted. For instance, if you would leave the hospital or your practice with a white coat, the chances of you being kidnapped to treat someone of a drug cartel and then killed was very high. So that's what one of the things that the Undersecretary of Health in the state said. Everyone has to take their white coat off before leaving the hospital, because your chances of getting kidnapped is very high. Or the other thing that the fact that if they would be doing surgery on a member of a drug cartel or a military that was in a chase, there were cases where members of an opposite drug cartel or a drug cartel would come and shoot the person that was in surgery and killed, and doctors would be injured. So it was a terrible situation. But even then, in the children's hospital and the city capital of that state, there was someone that was beheaded. Their head was left by the children's hospital, because the children's hospital there is close to the prison, the state prison. So anyway, it was a kind of intimidation. So you have a situation where that's one level. Then the other level is the level of corruption. Doctors did not have the resources. I had to take my child. I was there doing field work and with my 4-month baby there, and I had to go to the children's hospital. I went to the public one. And the doctors were telling me, at some point we had to treat patients without air conditioning at 40 Celsius degrees because the air conditioners that were sent to us were not working. And they were actually, when I looked more into it, they were overpriced, and they were the contract was given to someone that was connected to government. So it was a terrible situation. But even then, the doctors treated the poorest people in the world with so much care and dignity. My child was treated the same way as the person who came from a rural area that makes, $1 per day. So that was really interesting. And the connection with St. John, I think it's for me that, again, when I came to St. John, there was a heli airport by the harbor passage. And I heard the helicopter and I started freaking out. I started PTSD. I was like, oh my God. And I'm like, no, I'm in St. John. where actually, when I got there in 2010 and I stayed downtown, I was looking forward to go to the market and buy food, etc. on a Sunday, because I arrived on a Saturday night. And my surprise was that no one was there. Everything was closed. So I was like, what's going on with public space? In Mexico, we cannot access public space because of the violence. And here people do not use public space because they don't want to. So that was really interesting experience. And then again, the public space is so vital for health in terms of interaction, in terms of having fresh air, dealing with issues of isolation, etc., civic engagement. The only interesting thing that came out of that was that I saw that Queen Square was so underutilized. And it was such a beautiful space. So I talked to a friend who used to work at the city, and I'm like, why no one does this? Why no one occupies this space or uses this space even more? What would be some of the obstacles of having a farmer's market? Would it be like, do you get an extortion fee like you get in Mexico? Do you have to deal with political issues, corruption issues? No, he said, no. And I'm like, okay, why don't we just start a farmer's market? And that's why the Queen Farmer's Market started. Right?
Oh my gosh. Really? I didn't know you were part of that. So there you go.
I organized the first farmer's market there. So, and that came again from this experience of violence, of people not using public space, but on the other hand, also the importance of public space in providing healthy produce to people without having to go to the superstore, which is something that we see a lot in Mexico with the little markets. They are not fancy markets, but they are just vendors that come with the food they grow.
Markets.
Yeah, exactly.
Yeah, I mean, we've had a lot of connections with our patients to some of the co-ops for fruits and vegetables, that there's a lot of opportunities in the city to have really affordable packages of vegetables, and some of the trades that are going on between different people who are growing maybe in community gardens and things. I think those are some huge opportunities here in the city. And I've heard people talk about even and maybe it even exists. And so if somebody listens to this, they should tell me, but a mobile opportunity to bring some of these products to some of the neighborhoods that may have less access. I want to go back to what you said about terrifying and horrific stories of Mexico, but I don't want to lose the point that despite those obstacles and very challenging work environment, the ability for people on the front lines to still show that compassion and care and treat people with dignity and respect. And I just think when you're working in St. John and surrounding area with the type of challenges we have with the social determinants of health and poverty and whatnot, how it just goes to show how people can overcome these obstacles and still provide citizens with good care, which is such a blessing, I guess, just to say out loud.
Yeah, no, I agree with you. But I think it's also important that we as a community not only rely on this resiliency of reduced group of people, but actually we support the health workers. We support our vulnerable populations as well. And I think one of the things that we might need to start discussing at some point is the underrepresentation of priority neighborhoods in city council. You only have very few representatives or council members representing priority neighborhoods. So that's something that we need to start discussing on how we can actually give people in those communities larger voice, that is not only confined to the people that work in the community centers, but also kind of directly speak. Yeah. People.
Yeah, and how can we do that in a safe and accessible way?
Exactly.
That also treats them with dignity, because I think sometimes just throwing people into an environment, well, let's say like a board, for example, a nonprofit board. So we're always trying to look for ways to make sure that the decisions and the ideas are coming from the community, because why else are we there if not for that? But making sure that you don't throw people into a situation that actually makes them more uncomfortable.
Exactly. No, and one way in which, for instance, this was started in Brazil. As you know, Brazil has one of the highest levels of inequality in the world, right? Like you have a lot of poor people, and I think that's one of the issues with COVID right now in Brazil, the high levels of inequality, poverty, and racism involved, in addition to, the new government that is very neoliberal in the sense that it doesn't care about health, doesn't care about the environment, it just cares about making money. But going back to the point is that in Brazil, one of the experiments that came up at the city level was participatory budgeting, exactly because those inequalities were reflected in the city. The people that were making more money had better services, had cleaner neighborhoods, had safer neighborhoods, and the people that were making very little money, even though they were working very hard, were the ones that had the worst housing conditions, the worst crime. Their neighborhoods had a very bad crime rate. So one of the things that came out in there, in order to make this environment accessible to people that live in poverty, and as you said, to make it safer, not make them feel more uncomfortable, was participatory budgeting. And participatory budgeting is about distributing the city in different neighborhoods or districts. And then those districts have a division where people at a sub-neighborhood level actually interact and participate and decide how a section of the budget is going to be spent. Oh, wow. And what are their needs. And then a representative takes it even further to a higher level. And then that higher level takes it to, I think, another level, and then city council. But it's really bottom-up, grassroots, local democracy, right? And this has been implemented in Parkdale in Toronto and also in Le Plateau in Montreal as well. So I think that's something that we might have to discuss as well. Also, another thing that has been done in Latin America to be able to hear people's voices more closely in a context that is comfortable for them is community promoters. And it's about people that are trained within the community. People that have training that come from the community are the ones actually talking to the people in their community about health, about food, about crime prevention, about housing rights, tenant rights, how to defend your rights, how to civically engage, etc. So that's best practices that are out there that can be considered.
Yeah, I feel like there's so many. I mean, obviously we're looking for innovation and new solutions to complex problems, but when there's so much promising practice out there, I find it a source of frustration that, just even in this shy of an hour conversation, I've learned so much. And, are there opportunities for St. John and surrounding municipalities to learn from? Dalhousie medicine faculty and students, there's tons of advocates. There's tons of people who really want to make a change. Am I using the word tactical urbanism that properly then? If people are really looking to, I know that's one of your interviews that's on your site. You have lots of references and publications. I was drawn to that one because, I think it's important that people have their voice and use it. And so if we have the ear of municipal councils as high-income folks, how can we use that to better the health of our society?
Well, I think one of the things that, in relation to tactical urbanism is making small changes in your community. And it's actually without really asking for permission to the city government.
Okay, well, that's up my alley then.
Yeah, but working in consultation with them. So if you have an idea about, for instance, some of the projects that came out during that particular experiential learning activity was start thinking about having some infrastructure in place for the Rainbow Park skating rink. So one of the initiatives that started that, it didn't require municipal permission was to have a skate exchange program in the lower South End. But then start thinking about also how we can have infrastructure in place that allows people to be there more in the winter, to have fresh air, to do exercise in the winter, which is super challenging in cold places like St. John, but have been done elsewhere in Canada or in Europe as well, right? And that's when you start actually working with city government to see how you can take that project further.
Those ideas are what draw people into communities too. Just the idea of having the infrastructure there to have a really nice experience in the wintertime is something for everyone to enjoy.
Exactly.
Drawing people into communities too, and just promoting kind of the integration of different communities.
And that's how you can actually start. It eventually becomes institutionalized, like the Queen Square's farmers market, right? Like it started as a tactical urban experience, getting the proper permissions from public health, asking for permission to use the square. But, it didn't involve city government in the making. But
like from a bureaucratic standpoint, to have to go up the... Yeah.
But it became institutionalized, and now, the city government considers the market as a feature in the urban landscape, right? So...
Oh, yeah. I think there'd be a lot of people who would be very disappointed if the Queen Square market stopped.
Yeah.
Including my kids.
I think that's what, tactical urbanism, would be about. The other thing, I think not only health practitioners, but all of us that have a good income is that start thinking about how we're overrepresented in city council and in the provincial legislature, and how that overrepresentation actually has effects on urban inequalities, and how urban inequalities do affect health outcomes. And this has been, since 2010, the WHO issued a report saying, what, it is in the city where you actually see the social determinants of health materialize. That's why we need to start thinking more about cities when we think about health. This has been happening since 2010. And I think COVID has actually made us rethink the city in health terms as a public health issue, not only as an urban politics issue or an urban sociology issue, but also public health issue.
Well, I was going to ask you for your take-home message, Hepzibah, but dare I say that you just said it, that health is in all policy, and health is in our municipal government as well. And we see it, especially in St. John, as the social determinants of health. We talked about public and active transportation, infrastructure with water and sewage. We talked about safety with fire and police and community policing. We talked about zoning, and we talked about, some of those extras with the social determinants of health as well. I think we've given people a lot to think about as they go to the election booth in the next couple of days. Any other words that you have for us going forward? Thank you so much for being with us.
I think my other message I want people to take home is that don't take for granted the access that we have to local politics. Like in Mexico, my experience in Mexico is that we don't have that access to local politicians to have our voices heard. We shouldn't take it for granted. We should always keep our politicians accountable at the local and provincial level. And we shouldn't take public space for granted. That's one of the things that, my experience working in violent contexts have told me, that public space is so important for so many things, from civic engagement to health. And we should somehow make use of it when we can, and also ask local politicians to always keep it safe and available, and also have facilities that can allow our physical and mental health to improve as well.
I think your words have landed with me for sure, and I'm pretty sure I'm going to have a lot of different thoughts the next time I hear a helicopter overhead, and a lot of gratitude. So thank you so much for being with us today, and thank you to all the listeners for staying with us on the FacDev Lounge podcast today, and don't forget to vote on May 10th and have your voice heard.
Thank you.
Thank you for listening to the FacDev Lounge podcast. Please leave us a review on iTunes, YouTube, or SoundCloud, and even a comment on some ideas for future podcasts. Thank you very much, and have a great day.